Hi, my name is Catherine Bertram and I work for Johns Hopkins Center for Communication Programs. Within READY, my role as social behavior change advisor is to challenge humanitarian organizations to be more community-centered in their response to major disease outbreaks by applying the principles of risk communication and community engagement in their technical and operational readiness planning. I contributed to this framework by integrating practical actions that put communities and their local context first across the sectoral interventions and throughout the entire program cycle. So let's look at a scenario. Your organization decides to respond to COVID-19 in your region by supporting community-based and non-pharmaceutical interventions. Specifically, you aim to provide aid to people who are in isolation and quarantine in their shelters or homes in humanitarian settings. So how will this framework help you? So we need risk communication and community engagement so people can reduce the risk of disease transmission and the impacts of major outbreaks on their lives. And this should cut across all health and non-health responses. So if my role is to manage a response, I want to make sure I have staff who are trained in basic behavior change and community engagement processes. I want to know the barriers to compliance with quarantine and isolation measures and related perceptions of communities around these measures, what the rumors are, and what kind of stigma is associated with these measures, for example. People will have many needs during isolation and quarantine. So for planning and implementation, it will be important that my team support communities to identify and solve these barriers based on what already exists in the communities, like capacities and networks. We can plan for some shared outcomes across sectors for community engagement activities because people are not defined by their sectoral needs alone, and anecdotal evidence suggests that a more holistic approach works. I want to make sure that we are integrating risk communication and community engagement in the work of other sectors. So for example, consider that if a new outbreak turned a community into a hotspot with many people under quarantine, some people might hide from contact tracers or deny association with people who were confirmed positive with COVID-19, especially in humanitarian settings where mistrust and health systems and government is usually higher. So as indicated in READY's integrated framework under community health programming, if I am managing a team of contact tracers, I would assure some are from the communities themselves and that they engage with formal and informal trusted community leaders who can support them in building relationships with people in the community and understand those community concerns. I would link with risk communication and community engagement coordination mechanisms or other partners in the community to see what information I can use on perceptions and rumors about quarantine and isolation or contact tracing to adapt those messages or change course based on these concerns. When response teams are already equipped with community contexts and concerns, when they know what rumors are circulating, they can provide better support and additional information when communities need resources for a variety of issues, like how they can get maternal and newborn care or water to ensure they can practice hygiene while under quarantine. So for more information on this example or other ways in which you can integrate risk communication and community engagement into your response, head to READY's website.